Hello, my name is Dr. Indy and I am an OBGYN with Community Health Network. Today, I would like to discuss the current recommendations for cervical cancer screening. I hope this will provide a better understanding of when and how frequently average-risk individuals should be screened for cervical cancer. The cervix is the lower part of the uterus that connects to the vagina. Most cases of cervical cancer are caused by certain strains of a virus called human papillomavirus, or HPV. The HPV virus can cause cells on the cervix to become abnormal over the course of a few years. The good news is that for most healthy individuals, the immune system will clear the infection before serious changes can develop. Thankfully, with the development of HPV vaccines and routine cervical cancer screening, serious disease and cancer is preventable. Average-risk individuals with a cervix between the ages of 21 and 65 years of age should have regular cervical cancer screening. Keep in mind that cervical cancer screening is still recommended for individuals who have been vaccinated with the HPV vaccine. Now, let's discuss how we screen for cervical cancer. The first way is with the Pap test. The Pap test is a simple procedure performed during a routine gynecologic exam in which cells from the cervix are gently collected and sent to a lab for analysis. Depending on your age and your medical history, an HPV test can also be added to the Pap test. An abnormal Pap test and/or a positive HPV test does not mean you have cancer. However, your provider will likely recommend follow-up tests to ensure the cells on the cervix do not progress to a cancer over time. The frequency of cervical cancer screening is based on your age and medical history. For most average-risk individuals between the ages of 21 and 29 years of age, cervical cancer screening is performed every 3 years with a Pap test alone. For those ages 30 to 65 years of age, cervical cancer screening is recommended every 3 years with a Pap test alone, or every 5 years with a Pap and HPV test, often referred to as co-testing. Cervical cancer screening is not recommended for average-risk individuals after the age of 65. Finally, if the cervix has been surgically removed for benign indications, cervical cancer screening is no longer recommended. As always, you should discuss your medical history and risk factors with your provider. Keep in mind, an annual gynecologic exam is still recommended even if you're not due for a Pap test. The pelvic exam is an important way for your provider to evaluate the size, shape, and mobility of the uterus and ovaries to ensure there are no worrisome changes each year. In conclusion, cervical cancer is a serious disease, but it is preventable with the availability of HPV vaccines and regular cervical cancer screening with a Pap test or a Pap and HPV test. Be sure to discuss your medical history and risk factors with your provider, and remember to schedule a routine physical and gynecologic exam every year. Let's work together to ensure you stay informed, stay healthy, and can take good care of yourself.